Many people believe one simple rule about gout: if uric acid is high, pain must follow. But that belief does not match what happens in real life. Some people live for years with high uric acid and never feel pain. Others experience sudden intense gout attacks even when their uric acid level is not extremely high. This creates confusion and often false reassurance. Today, we are going to explain why high uric acid does not always cause gout pain, and why the absence of pain does not mean gout is not developing. To understand this, we need to separate two very different things: uric acid levels and gout pain. They are connected, but they are not the same. Uric acid is a substance produced when the body breaks down purines. Purines come from normal cell turnover and from certain foods. Normally, uric acid dissolves in the blood. It travels to the kidneys, and it is removed in urine. Problems begin when uric acid stays high for long periods of time. This is called hyperuricemia. But hyperuricemia alone does not automatically cause pain. Pain happens only when a second process begins: crystal formation. When uric acid stays elevated, it can slowly form tiny monosodium urate crystals. These crystals can settle in joints, soft tissues, and around tendons. This process does not happen all at once. It happens gradually, often silently. In the early stages, crystals may be extremely small. They may not trigger a strong immune response, and they may not cause symptoms. This is one of the main reasons high uric acid can exist without pain. Gout pain is not caused by uric acid itself. It is caused by inflammation. Pain appears when the immune system detects urate crystals and reacts aggressively. White blood cells rush to the area. Inflammatory chemicals are released. Swelling, redness, heat, and severe pain follow. If that immune reaction does not activate strongly, pain may not appear. So the real question becomes this: why does the immune system sometimes stay quiet? One important factor is crystal stability. When uric acid levels rise slowly over time, crystals may form gradually. The body may partially adapt to their presence. Inflammation may remain low-grade or absent. But when uric acid levels fluctuate rapidly, crystals can shift or break apart. This exposes sharp edges and triggers immune activation. This is why gout attacks often happen after sudden changes: dehydration, illness, fasting, alcohol intake, or rapid changes in uric acid levels. It is not just how high uric acid is. It is how unstable the system becomes. Another key factor is joint environment. Different joints have different temperatures and blood flow. Urate crystals form more easily in cooler areas of the body. This is why the big toe is a common sight. It is farther from the heart. It is cooler, and blood circulation changes during sleep. But not everyone has the same joint conditions. Blood flow, tissue health, and micro-injuries all influence crystal behavior. This means two people with the same uric acid level can have very different outcomes. The kidneys also play a silent but critical role. The kidneys regulate uric acid balance. They remove excess uric acid from the blood. If kidney function is strong, uric acid levels may remain stable even if they are elevated. Crystals may accumulate slowly. Inflammation may stay minimal. But when kidney function fluctuates, uric acid levels can swing. This instability increases the risk of an immune response. Many people with silent hyperuricemia still experience kidney strain over time, even without joint pain. This is one reason gout is not just a joint condition. It is a systemic metabolic disorder. Another reason pain may not appear is immune sensitivity. The immune system does not respond the same way in everyone. Some immune systems react aggressively to urate crystals. Others react more slowly or less intensely. Genetics plays a role. Past inflammation history plays a role. Overall metabolic health plays a role. Pain is not a direct measurement of crystal presence. It is a measurement of immune response. This is an important distinction. Some people assume that no pain means no damage. That assumption is dangerous. Urate crystals can continue to accumulate silently. Joints can slowly become structurally affected. Kidney stress can increase gradually. By the time pain finally appears, the disease process may already be advanced. This is why gout often feels sudden. But in reality, it is rarely sudden. The first gout attack is often the result of years of silent imbalance. Another misconception is that a single uric acid test tells the full story. Uric acid levels change throughout the day. They change with hydration. They change with illness. They change with diet and medications. A normal reading does not guarantee stability. A high reading does not guarantee pain. Gout risk depends on patterns over time, not isolated numbers. This explains why some people experience their first gout attack when uric acid appears normal. The immune system may be reacting to existing crystals rather than current blood levels. It also explains why some people with high uric acid never experience classic gout pain, at least not yet. But silence does not equal safety. Over time, persistent hyperuricemia increases the likelihood of crystal growth. It increases the chance of immune activation, and it increases long-term risk. Gout pain is not the starting point of the disease. It is a warning signal. By the time pain appears, the system has already been stressed for a long time. Understanding this helps explain many frustrations people experience, why lifestyle changes alone sometimes fail, why attacks seem unpredictable, why pain comes and goes. Gout behaves more like a chronic metabolic imbalance than an on-off switch. This is why focusing only on pain misses the bigger picture. High uric acid without pain is not harmless, and pain without extremely high uric acid is not unusual. They are different expressions of the same underlying process. The goal of understanding gout is not to fear pain. It is to understand the system behind it. When gout is viewed only as a painful joint problem, it appears random and confusing. When it is viewed as a long-term metabolic condition, the pattern becomes clearer. In summary, high uric acid does not always cause gout pain because pain depends on inflammation, not numbers alone. Crystal formation can occur silently. Immune responses vary. And stability matters more than isolated levels. The absence of pain does not mean gout is absent. It often means the disease is quiet. And quiet does not mean inactive. In the next video, we will explore what happens when gout progresses over time, and why repeated attacks are not simply bad luck, but a sign of deeper imbalance. Understanding gout clearly starts with understanding silence.